Hey everybody, hope you're doing well. Hopefully you have mastered the axial skeleton, the axial component of the skeleton lab, and you are getting everything ready to start whooping some butt on this lab test. Again, this is a tough lab test, so I want to make sure that you are focusing as much time as you can right now. This can be a pivotal part in the semester with your grade, and I only want everyone to succeed. So please make sure that you're studying as much as you can, as well as you can, using your time effectively and preparing yourself to do really well on this test and for the rest of the semester. All right. So don't forget, axial skeleton covered the skull, the vertebrae, and the rib cage, all the way down to the sacrum and the coccyx. Now, appendicular skeleton has to do with the appendages, your arms and your legs, and also those bones that attach the arms and the legs to the axial part of the skeleton, which we call the girdles. So we've got a pectoral girdle, which attaches your arm, and a pelvic girdle, which attaches your leg. Now, let's start up here with our pectoral girdle. So here is our scapula, right? Here is the shoulder blade. When we look at the scapula, here is a posterior view, and here's an anterior view. In other words, this is the part that hugs onto the back of your rib cage, and this is the part that sticks out of your back. Okay. When we look at this bone, first off, I want you to realize that this long side over here always faces towards the middle. This long side faces towards your vertebrae. So we can label the long sides as medial, and these other sides that have the socket on it over here with these bumpy things at top, this is the lateral side, right? And so this kind of helps us. What we're looking at here is a left scapula. And again, here is a left scapula just from the different view, anterior versus posterior. When we look at this, the main part of this bone right here is called the body of the scapula. And hanging out of the back side of the body, we see this big projection that sticks out. This big projection is called the spine. Now the spine reaches all the way up and it ends at this expansion. This expansion is called the acromion. Now we can see right here in the background, here is the acromion popping out. Okay, not the part right here, but behind it, we see the acromion popping out. The acromion is what attaches to the clavicle and helps to create the pectoral girdle. Now, I mentioned the socket. Let's go ahead and cover the socket. This socket is the glenoid fossa, or the glenoid cavity, and this is where the head of the humerus attaches to create your shoulder socket. And so the glenoid fossa, or the glenoid cavity, has this bony projection hanging off of it. And you can only see it on this anterior view. This bony projection is called the coracoid process. I almost called it coronoid. I had to double think. So there is the coracoid process. And that brings me to a point, right? Some of these terms have very similar names: coronoid, coracoid. So you got to make sure that you study these and you spell these properly, because you mix those two up and you got them wrong on the test. You know, I just got that one wrong myself because I was going to call it coronoid, but this is our coracoid process. Okay. Now, when we look at the rest of this bone, practically all of the rest of this is named after location. This border at the top is called the superior border. This border towards the middle is called the medial border. And this border below the socket is called the lateral border. It's pretty easy, right? Not too difficult. Then we have this little dip above the spine. This dip, we can really see the dip below the spine right here in the shadows, but there's a dip above the spine. And this dip above the spine is called the supraspinous fossa. And the dip below the spine here is called the infraspinous fossa. This dip right here on the front side, so this region right here, if you could hold the bone, it would be dipped in, especially right in that area. This is dipped so it fits on the back of those ribs, right, and kind of floats on the back side of your rib cage. This fossa is called the subscapular fossa. The subscapular fossa is actually on the front side. And again, this is what kind of curves around and helps kind of attach you to the ribs. Here is an odd view. This is from the side, and here's that socket again. So here is the glenoid fossa, and we see hanging off the glenoid fossa is the coracoid process. And then here we can see the spine coming out from the backside, and the acromion attached to the spine. Okay. Now, let's take a look at the clavicle. Here is the other component of the pectoral girdle. This is the clavicle. There's one side that's flat and one side that's a little fatter with a bump on it, right? The side that's flat attaches to the sternum, to the manubrium beside the jugular notch. And so this side is called the sternal end or the sternal extremity. And this side over here is called the acromial end or the acromial extremity because this is what attaches to the acromion. So again, this is attaching right here the scapula and then right here the sternum. So this is really the only bone-to-bone connection that holds your arm on to your body because that scapula, as I mentioned, is just kind of floating back there on top of the muscles of your back. This little bump that I mentioned, and we can see it down here as well, this little bump is the conoid tubercle. So the conoid tubercle, again, a tubercle is going to be where we see a lot of ligaments many times that are trying to attach, kind of trying to stabilize that joint and strengthen that joint. So together, those two bones made that pectoral girdle. Now let's look at the arm. Okay, here we can kind of see a view of the arm. The upper bone in the arm is the humerus. And then in the forearm, on the thumb side, we have a radius, and the radius looks like it's a nail head at the top. And then we have the ice cream scooper on the pinky side, and that is your ulna. And then we see your wrist bones, the carpals, and your fingers called phalanx or phalanges. Now, this is a view of the humerus, and I had to spin it around so I could get more of the bone on here to give you more details so that you could actually use this presentation. When we look, this bottom part is a posterior view, and this top part is an anterior view. Okay, so from the front on top and from the back on the bottom. Now, we can see this nice rounded head here, right? So there's the head of the humerus, attaches to the glenoid fossa or glenoid cavity of the scapula. Right below the head almost kind of looks like a mushroom cap. Right below the head is the rim of the head. This is called the anatomical neck. So the rim of the head of the humerus is called the anatomical neck. Down here at the metaphysis, at the kind of the point where the epiphysis kind of gets skinnier to become the diaphysis, this is called the surgical neck. So there's two necks, the anatomical neck and the surgical neck on this structure. Now, facing forward, here is, again, the head. Facing forward, we're going to have something that sticks out right here. Okay, this part that sticks out in the front, you can even kind of feel this in the top part of your upper arm, where in your shoulder, you can feel this little bump. This is the lesser tubercle. And then opposite side of the head, kind of lateral and also posterior back here, then we're going to see the greater tubercle. So lesser tubercle, skinny, just goes up and down right in the front. Just kind of here, I'm kind of making a box to represent it. And then the bigger rough region out to the side, opposite of the head, is called the greater tubercle. Again, these tubercles are going to be for muscles and tendons, ligaments to attach to stabilize that shoulder. Now, in between them, we do have a groove, and right here is kind of that groove, okay? So you can't really tell it right here. It's sometimes easier to actually see right here on this view. But we can kind of see going up and down right here is a groove, and in front of that groove is going to be the lesser tubercle, and over on the other side of that groove is going to be the greater tubercle, and that groove is called the intertubercular groove or the intertubercular sulcus. Now, this rough region is called the deltoid tuberosity, but I don't care about that one for this test. We've got a lot, and this is a tough thing to pick out in the middle of just the shaft of the diaphysis. So let's mark that out. Deltoid tuberosity, I don't need for you to know that for the test. Let's also mark out the term epi whenever it says medial and lateral condyle. Okay, I want to refer to them as the medial and lateral condyles, not the epicondyles. And so Well, actually, my bad. Let's mark out both of those, medial and lateral epicondyle. I'm not even going to discuss those. I'm going to talk about these a little bit differently. I'm sorry. I'm sorry to be confusing there. So overall, we just marked out deltoid tuberosity, medial and lateral epicondyle under humerus. Now, when we get down here to the bottom, we can see that on the front, there is this dip, and on the back, there's an even bigger dip. And this is the easy way to tell front from back. The big dip in the back is for the bony part of your elbow to fit into the olecranon. So this dip is called the olecranal fossa, and this dip in the front is for the another part of the ulna called the coronoid process to fit into. And so here is the coronoid fossa. So on the front, we have a smaller dip, the coronoid fossa, and on the back, we have a larger dip, which is the olecranal fossa. Now you notice right here is a little trough, right? This little groove, and it goes front to back. So we can see this groove going front to back. This is actually what the ulna attaches to, and it kind of swings around it, pivots around it, hinges on it. And so this is called the trochlea. Okay, if it goes front to back, it's the trochlea, right? Now, only on the lateral side, right here, the lateral side of the trochlea, we see this smooth bump only on the front, on the lateral side of the trochlea. This is important for the head of the radius to kind of pivot around as well whenever you flex at your elbow. This is called the capitulum. And so the capitulum spelled capitulum. And so there is the last part on this humerus, the capitulum. Now, let's take a look at the ulna. Here's the ulna. Again, it looks like an ice cream scoop. You can kind of see that scoop. And so this, again, is on the pinky side of your forearm. That's a good thing to know. When we look at this scoop, the inside of the scoop is called the trochlear notch, because this is the component that grabs a hold of that trochlea and allows us to create that hinge joint of the elbow. So here's the trochlear notch. The back side of the elbow is called the olecranon. So this is the bony part of your elbow. Okay, on the back, this is your olecranon. The front lip of the ice cream scoop is what comes in contact with that front dip at the bottom of the humerus. This is the coronoid process. So here is that coronoid process, and it is poking out of the trochlear notch, and on the backside trochlear notch again was that olecranon or olecranon process, olecranal process, either way. Now you can barely see right here. This again is that coronoid process sticking out, but it's got a chunk eaten out of it, taken out of it. This little chunk is called the radial notch. So this is where the radius fits in and starts to rotate, starts to pivot around. Whenever you rotate your palm from facing one direction to facing the other, then you're rotating that radius on this radial notch, the head of the radius. Now, feel on your forearm. Find the pinky side, find your ulna, kind of halfway down your arm, and then follow it up to your wrist. And right before you hit your wrist, you're going to feel a big bump right there on your pinky side of your wrist, right before the actual wrist bones. This is that little bump right there called the styloid process, the styloid process of the ulna, either way. Your arm bones and your leg bones are the same thing. They just modified to do different functions. So if you feel down in your leg at your ankle, you can feel those two knots, right? Those two knots kind of wrapped around your tarsals in order to provide stability because you walked on them, right? You took a lot of strength. But up here, we don't walk on our hands. Instead, we use them to manipulate things. So we've got those same knots. They're just really small because they're not needed to take weight. Okay. Now let's move forward and let's take a look at this radius. The radius is the thumb side bone in the forearm. And I always tell my students, look for that nail head, right? Really skinny, looks like the head of a nail. Then that head of that radius kind of gives it away. And again, there is the head. Right below it, there's a constriction. That's the neck. Just about any constriction below a head on a bone is going to be a neck. And then we get to this bump, and we can kind of see it poking out here, or we can kind of see it poking out at us right here. This bump is the radial tuberosity. Okay, I prefer you call it the radial tuberosity, not the tuberosity, because there's many different tuberosities in our body. So refer to it as the radial tuberosity or the radius tuberosity. And again, this head likes to rotate on the ulna at that radial notch. And then this is going to be for attachment for some of those ligaments to make sure that we don't over rotate and kind of break our forearm. Now down here at the bottom, just like on the ulna, we've got this part that sticks out farther than everything else. Find your radius halfway down your forearm and then chase it to the wrist, and you can feel this one poking out a little bit better right before you hit your actual carpals. There is the styloid process of the radius, or just styloid process is fine. Now, let's move in and let's talk about these carpals. Here are the carpals. I don't really want you to focus on all of these carpals for our test. So I only want you to know one carpal. Let's know two carpals, okay? I want you to know two carpals. So I want you to know this one right here. This is the one that the radius kind of comes in and meets with. Let me go back and show you this real quick. Notice how right here the end of the radius is scooped. And so the end of the radius is scooped so that this bone right here can fit into it, and it basically creates the main attachment for your wrist. And so this is called the scaphoid bone. Okay, scaphoid or scaphoid. And then also I want you to know this one right here at the base of the thumb. This one at the base of the thumb is called the trapezium. Trapezium. And so this is important because it helps us to twiddle our thumbs. We're going to talk about this in chapter 9. So I want you to be a little bit familiar with this bone that helps create a saddle joint called the trapezium. Anything else? Don't worry about it. Okay, so mark out the rest of those: lunate, triquestrum, pisiform, trapezoid, capitate, and hamate. Mark those out. I'm going to ask you three questions. What are all of your wrist bones called? Carpals. What is that one wrist bone right there called? Scaphoid. What is this one at the base of the thumb? Trapezium. Okay. Now from there, we can see these first long bones that come out of the wrist. The first long bones that come out of the wrist are called the metacarpals. Same thing. First long bones out of the ankles are going to be our metas. Down there, it's the metatarsals. Up here, it's the metacarpals. So here we see the metacarpals. And I definitely want you to know that we number these from thumb to pinky. So the thumb is number 1, 2, 3, 4, and 5. Pinky's always number 5. Okay. So if you hear somebody say that they broke their 5th metacarpal, that means that they broke this one right here. Right. Now, after we get past the first long bones, we have 3 more bones in our fingers and only 2 in our thumb. But these next bones, anything past the first ones are our metas. Everything else is the term for finger or toe because there's the same thing. These are called phalanx or phalanges. Now, I don't care if you know the term proximal, middle, and distal phalanx, but you should know 1, 2, 3, 4, 5, right? Be able to number them, and that takes care of it. So I'm simplifying this hand. I don't want to waste time on the hand and you not focus on the important stuff because the hand is not as important as the other bones in the body. A lot of instructors really force you to learn too much on the hand, and then you fail everything else. And that's not what I want you to do. I want you to be successful in everything else. If you become a hand nurse, then you will then focus on the hand and learn it in detail. Right? So you'll need it. If you need it, you'll learn it in your program. Here is our next group of bones, and here is a pelvis. But what this is demonstrating are the 2 coxal bones. Here is the 2 coxal bones, commonly called the hip bones or os coxa, and they fuse right here in the middle. And you can even see how they attach to the sacrum right there, as I mentioned, in the sacrum. And so whenever we're looking here, let's go ahead and let's point out that this connection is called the sacroiliac articulation. In our textbook or in our lab manual, I think it says sacroiliac joint. That's kind of lame, but let's put articulation if you can. If you put joint, that's fine. But this is just the connection between the sacrum and this upper part of the coxal bone called the ilium. Okay. Now this ilium is really made out of 3 separate bones. So let me teach you a little bit about that. This socket right here, first off, let's learn this. The hip socket is called acetabulum, right above sacroiliac joint in our list. There's the there's the acetabulum, spelled acetabulum, but this is where the head of the femur fits in and attaches to create your hip joint. About halfway down there. So maybe cut through this right here. If you chop through that bone right there, everything from that chop and above is part of the ilium. And then you take these 2 arms right here. Here's an upper arm, here's a little body, and then there's a lower arm. Take the 2 arms, a sideways V is what it looks like. This is your pubic bone. And then everything else that's not part of that upper part or the 2 main arms is going to be the ischium. And so here is the ischium down here at the bottom. When we look up here, and let's kind of do these on individual bones. Again, at this point, there and above is basically the ilium. The two arms are basically the pubic bone, and here we get a better view of the ischium overall. Okay. Now, when we look at the ilium, we see the top ridge of this bone. This is called the iliac crest. This is your hip margin. You can feel this point right here in the front of your hips, kind of poking out a little bit. This point is called the anterior superior iliac spine. And then back here, kind of this curve, and it's the same part right here. This is the posterior superior iliac spine. Okay, so the anterior superior iliac spine, there's another view of it on the other side. And then here's the posterior superior iliac spine. Okay, so these are just kind of points, these spines. We can notice right here that the inside of your hips is scooped. That scoop is called the iliac fossa. So the scoop portion is the iliac fossa. And we're going to find some muscles located in there called the iliacus. Now, here we can really see this rough region where it attaches to the sacrum, to your fused vertebrae at the bottom of your vertebral column. So this is the auricular surface, or if you put sacroiliac joint, sacroiliac articulation, I would take that as well. Now, another good landmark on this bone is this big cut. And this big cut is towards the back. And so maybe that can help you kind of remember this greater sciatic notch is on the posterior side. So again, that makes this the posterior superior iliac spine. And on the opposite side, that anterior superior iliac spine. When we look here at the ischium, okay, first off, the first part of the ischium is this little spike that sticks out at the bottom of the greater sciatic notch. This is called the ischial spine. And what it does is it helps to create another little notch below it. And this little notch is called the it's called the lesser sciatic notch. Sorry about that, not the inferior, but the lesser sciatic notch. We got the greater sciatic notch, the ischial spine, and then the lesser sciatic notch. Now, right beside it, we can see this rough region on the ischium. This rough region has a lot of muscle attachment. This is also what people call your butt bones or your sit bones. So this is called the ischial tuberosities, right? You can kind of see this rough region right here. It's kind of raised a little bit, and there's the ischial tuberosity. So if you've never been mountain biking, you should go mountain biking and don't wear any padded shorts. And then after about 45 minutes, your butt's going to feel like it's on fire and it's just getting needles poked into it. And you're going to feel these ischial tuberosities, right? You're going to feel the pain from the tendonitis there because you don't really use that region very much. Now, towards the front, we can see here is one arm and here is another arm. This is the pubic bone, right? This is the superior ramus. Again, arm means ramus in Latin, or arm is Latin and ramus in Latin. So here is the superior ramus and here is the inferior ramus. Now, where these two bones come together in this point right here, this is called the pubic symphysis. Okay, so this is a connection. It can dissolve. It does dissolve during pregnancy and at birth. It allows the hips to open wider to create a larger birth area. And so this pubic symphysis is it's the same cartilage as our intervertebral disc. It's fibrocartilage, and it just allows a little bit of flexion here at the hips as you rotate. Here's the largest holes in our skeleton. These large holes are the obturator foramen. Okay, so they're called obturator foramen. There's an obturator nerve that runs through here, some obturator blood vessels that run through here as well. And so there is the actual largest hole. It's bigger than the foramen magnum, okay, in our skeleton. Now, here's the lower leg. We can see the femur, we can see the tibia and the fibula. Make sure that you spell those right and say them right. Tibia, fibula, right? Make sure that you say them and do it right. And then we hit the tarsals, which are the ankle bones. And then we have the phalanges, again, which are the toes. Here again, I've had to turn these bones sideways so we could get a better view of them. Here's the femur. When we look at this femur, first off, this upper view is an anterior view, and this lower view is a posterior view. Now, on each of these views, we can see this head. So here is the head of the femur. And on the head, on each of these views, you can see a little dip. You can't really see it straight on, but it's a little pit in the head. And this pit is called the fovea. Fovea capitis, or just fovea is fine. And so this is important for some ligaments to exit the femur and attach right here inside the acetabulum. And so this provides an extra strong support for that hip socket. Of course, right below a head, we're going to have the constriction, which is the neck. And then on the back side, only on the back side, that's how we can tell front versus back. Here we see these two spikes, these two things that stick out. This is the lesser trochanter, and this is the greater trochanter. Okay, so the greater trochanter is a big spike, and the lesser trochanter is just a small bump on the femur. When we get down here to the bottom, we can see that there's these two pads, right? These look like our occipital condyles, so we're going to call these the condyles again. And again, I want you to mark out the term medial and lateral epicondyle. Let's keep medial condyle and lateral condyle. Let's mark out the epicondyles. I'm actually pointing out the epicondyles, but I want you just to call them the condyles because that's what most people generally call them. And so, you know, again, if you need to be that in depth in your program, well, then you're going to learn that once you get there. This is the medial condyle, and this is the lateral condyle. Again, this would be the medial, and this would be the lateral. The head has to face medially, and so the side with the head has to be the medial side. So this pad is the medial condyle, and that makes this opposite one the lateral condyle. And then in between, we see this intercondylar fossa, right? This dip in between the two. And this allows for the top of the tibia to come in and kind of lock in place to help stabilize the knee just a little bit. Now, I'm missing a good view of the patella, but here might be where I would get it from. There is a view of the patella, and that view kind of shows you your kneecap. Okay, so that probably is the only view that we have in our lab manual. And then we're going to do the tibia and the fibula. So let's move to the tibia. Here's the tibia. Again, this is an anterior view, and this is a posterior view. Okay, so anterior on top, posterior on bottom. When we look towards the anterior, we can see this rough region towards the front is called your tibial tuberosity. This is important for your quadriceps tendon, your rectus femoris tendon to attach from the upper leg across your knee through the patella. And so this is important. You can even kind of feel this thing poking out at the top of your lower leg, kind of where that tendon attaches and holds that patella in place. Now, it's really kind of tough to see this, but this little rough raised region right here on top of the tibia, this rough raised region is what I just talked about, fitting in that intercondylar fossa of the femur. This is the intercondylar eminence of the tibia. And so this little rough region that sticks up, it's usually got two little humps on it. This is the intercondylar eminence, and it just helps to stabilize the knee joint. Now, as we look at this, on each side of that intercondylar eminence, we've actually got some smooth pads right here that really aren't that easy to see. So the very ends of the bone, and I'll demonstrate this in class, I'll kind of point this out to make sure that you see it. There are some smooth pads, and these smooth pads meet up with the condyles from the femur. From the femur. Now, in order to figure out which one these pads are, we need to find a landmark. And this little thing right here is going to be our landmark down at the opposite end. This little thing is called our medial malleolus. This is kind of like the styloid processes in your wrist, but fill down in your ankle towards the medial side, towards the inside of your ankle. There's that knot, and that's what this is. This just wraps around your tarsals to kind of hold everything in place and keep things stabilized. But what that does also is it tells you that this side and this side of this bone is the medial side. So this smooth area at the top over here would be the medial condyle of the tibia, and this smooth area over here would be the lateral condyle of the tibia. Okay. Now the fibula is a lot easier. Okay, the fibula is a lot easier. You've got one end that's just kind of slanted and a little bit just kind of knotted up. Then you got this other end that's almost a little flat on top. Okay, the end that's kind of a little bit flat on top, this is the head, and right below it we have a constricted neck. Now, this little knot down here is the knot that sticks out on the lateral side of your ankle, right? And so you can feel that. You felt your medial malleolus just a second ago. Now, down here, this is from the fibula. There is your lateral malleolus. That's the little knot sticking out on the outside of your ankle, okay? Now here's a foot from above. Again, we see all of these tarsals. Okay, here's tarsals in general, and I'm only going to do 2 total tarsals. Okay, and that kind of keeps things simplified. The 2 tarsals I want to do is this one right here. This is the one that's on top. This is called the talus. So this is where the end of the tibia and fibula kind of wrap around to stabilize your ankle joint. So here's the talus, and then here is your heel bone. This is your calcaneus. Now, I want to show you from here. Here's the heel bone. Here's your calcaneus. And here's that top bone. It's almost kind of nice and rounded. And that is the talus. Now, again, all of these are going to be the tarsals. The first long bones out of the tarsals are always the metatarsals. And again, we're numbering from the big toe, 1, down to the pinky toe, 2, 3, 4, 5, right? So here is the first metatarsal, and there's the 5th metatarsal. Okay, now after we get past the first long bones, we're done with the metas, and we're into the phalanges or the phalanx. Again, just like the hands, there's a proximal, middle, and distal for the finger parts, but not the thumb part, the toe, big toe part, the hallux part. But overall, you should just know that these are the phalanges, and they're numbered big toe to pinky. 1, 2, 3, 4, 5. Okay. Now again, all the rest of those tarsals, you can mark them out. I only want you to know the calcaneus and the talus, and just know that all of the rest of them collectively are called your tarsals. And again, proximal, middle, and distal, dealing with the phalanxes, the phalanges. I don't really care if you use those terms on the test. At that point, we have completed all of the skeletal lab. And this is a lot of information, folks. Again, just to repeat from like what I said after the first part of this lab, this is a lot of information. So if you're not active with this information, or you're not using it almost every night, and you're not trying to learn and taking 30 minutes to an hour at least every night to really focus on this class, and especially on the skeleton stuff, then it's going to be super duper hard when it comes test time. So make sure that right now, before you get behind, you are giving it your best effort. If you haven't started studying by the time you start watching this video, you are behind. You are definitely behind. So before you start watching this, you should have already known, you should have already learned your skull at least, and then hopefully vertebrae and rib cage. So make sure that you're putting forth the effort that you need to be successful in the class. With this being one of the hardest tests, I'm not trying to scare you. I'm trying to make sure that you are prepared for this. If you know that something is difficult, then you should work harder at that thing. And so I'm just here to encourage you to make sure that you're giving that maximum effort. And I want to see a bunch of A's on this test. A good A on this test will stabilize your grade for the rest of the semester. A bad grade on this test will put you on a slippery slope that takes you out of the semester or with an F. So I really want everybody to succeed. So please do me a favor, and if you have any questions, feel free to contact me. This is, again, an important test, and I'm here to help. All right. I hope that y'all have a great afternoon, a great rest of your day, and I will talk to you soon.